Hello. Today I will be doing a virtual visit with a patient for her prenatal visit. AA is date of birth 5/20/23 and some background information for her. She is a 30-year-old G1P0 female at 10 weeks gestation, being seen here for her prenatal visit virtually. She reports some occasional nausea and vomiting and some lethargy, but denies any other problems at this time. Her past medical history is significant for hypothyroidism, which is currently managed with levothyroxine. She's up to date on all her vaccinations. And prior to becoming pregnant, she drank about 3 to 4 cups of coffee a day and then would drink on the weekends socially, like beer or whiskey, a couple servings of one or the other. And she has never smoked, vaped, or used any other tobacco products. So I'm going to log in there with her now. Hey, AA, this is Morgan. I'm a PA student that is working here in clinic and wanted to go over some things with you for this prenatal visit that will help out with managing your pregnancy. Thank you for filling out our information online. I do have all of your history here. So first off, I want to just discuss some healthy habits. So first off would be avoiding all alcohol. It sounds like mainly socially drinking right now, but exposure to any alcohol while baby is in utero can lead to fetal alcohol syndrome, which is the leading cause of preventable mental disability in the United States. So I just say entirely the whole time while you're pregnant, avoid alcohol. And then caffeine intake. Caffeine in excessive amounts can cross the placenta and lead to low birth weights or restricted growth. So try and limit your caffeine intake to about 200 milligrams a day, which is like a 12-ounce cup of coffee. I know that's a big cut from what you're doing right now. It would be a big cut for me as well, but just start scaling down your intake, like work on increasing the amount of water you're drinking, flavored water if you want, and then replace those extra cups of coffee with decaf. Exercise. Exercise can be a really healthy and beneficial habit throughout your pregnancy. It is recommended to get 30 minutes of moderate aerobic activity like walking, yoga, strength training, 5 days a week. However, like during this first trimester, try and avoid activities that have you flat on your back, like sit-ups, because those can put additional pressure in this area, making it harder for blood flow to get to the baby and just harder on your body in general. Also, avoid high contact sports where you might get injured, like skiing, hockey, rugby. If any of those are on your weekend list, just put them off for right now, or ones that you could fall easily doing, like roller skating. Also, just want to make you aware of intimate partner violence. I know that this isn't something that everyone experiences, but each visit I'm going to be checking in on you just to make sure things are going well at home and that you feel safe and supported. It's not a judgment on you or a judgment on him or anything about your situation, but I check in with all of my patients about this because the instance of abuse during a relationship can be as high as 20% during a pregnancy. So if you ever feel unsafe, please reach out, and I'll give you a card for some contact information there, but it's not a personal judgment. I check in on everybody with that. So some common symptoms you might be feeling during this stage of your pregnancy. You mentioned some nausea and everything online. Totally normal. Some normal symptoms that you might experience during this first trimester are nausea, vomiting, fatigue, and some breast tenderness. Those are all totally normal. Some other things that you might experience both this trimester and throughout the rest of your pregnancy include back pain, heartburn, hemorrhoids, vaginal discharge, and some urinary frequency. If you ever feel like any of these symptoms are unbearable or you're not sure if they should be happening, call clinic or send us a message over the portal and we'll get back to you as soon as possible to talk about what you can do to manage it and if you need to be seen. Some red flags to look for. So, like, those are some normal symptoms. Now, some things to, like, if these are happening, to be a little bit more vigilant about and let us know about pretty quickly. So, some of the things that might require more immediate attention or an ER visit could be excessive vomiting. So, if you're unable to keep any food or fluids down, you're at risk for dehydration. Some things to look for there would be dark or strong smelling urine that is different than your usual. Also, a weight loss of 5% or more of your pre pregnancy weight. If you don't know what your pre pregnancy weight is, go ahead and weigh yourself today and then just keep checking on that number. And if when you're vomiting, if that number just keeps going down, something to look out for excessive vomiting. Also, new onset headache or vision changes in the setting of high blood pressure. This isn't likely right now before 20 weeks of gestation, just because that's more preeclampsia, which would happen later in your pregnancy, but it can be a sign of severe hypertension that should be treated immediately. So, again, just keep an eye out. Also, vaginal bleeding. Bleeding beyond like a single occurrence or sparse spotting is something to be concerned about. If you have occasional like spotting, it may be a harmless condition that at times occurs during that first trimester, but it could also signal distress for the baby. And so you want to get evaluated as soon as you can. If you have an instance of spotting, go ahead and call clinic and we'll tell you when we can get you in to be seen. Nutrition is also super important during pregnancy. So your body needs extra energy to grow your baby, but it doesn't mean you should just eat excessive amounts of food all day long in large amounts. So during pregnancy, during this first stage, you want to eat an additional like 300 calories a day more than you normally would. Think about like an extra sandwich or a banana and peanut butter. Snacking on crackers and plain toast and things like that during the day can help get extra calories in and also help with your nausea. There are some foods you want to avoid during pregnancy just because of the risk that they pose. So, unpasteurized milk and milk products, raw or undercooked seafood, hot dogs and lunch meats, and then foods that are high in mercury, like shark, swordfish, and you should limit fish servings in general to 2 to 3 times a week. Make sure you're washing all your fruits and vegetables before eating them. And then your tastes may change and your preferences may change during pregnancy, and that's okay. Listen to your body and what it needs. Something you love now, you may hate in a week, and vice versa. You also will want to do some supplements. So we're going to start you on a daily prenatal multivitamin with iron, and then also folic acid at 400 micrograms a day. Also want to make sure you're getting in vitamin D, 600 international units a day. And we don't want you supplementing with any additional vitamin A. If you're on a vitamin A supplement right now, go ahead and stop that because too much of it can be detrimental to your baby. In general, weight gain, healthy range of weight gain during this first 12 weeks or the first trimester is about 5 pounds. And then you should expect to gain about 1 pound per week after that through the rest of delivery, since you are currently at a healthy BMI. So some expected things that you can have during your visits. We'll do a transvaginal ultrasound during this first trimester. At 10 weeks, we can start to measure from the head to the bottom on your baby to get an accurate estimate of weeks of gestation. We should be able to see the heartbeat on that ultrasound as early as 5 to 6 weeks. And then later in the first trimester, around 11 to 14 weeks, we can look at nuchal translucency, which is the thickness of the skin between the soft tissues of the spine, to help us look for conditions like Down syndrome or spina bifida. Other tests can be done abdominal ultrasound in our later trimesters. Well, you can also do an aneuploidy testing, which is a non-invasive serum genetic testing option. It's not routine, but for high-risk pregnancies or if you're concerned about genetic testing, we can look at that. We can look at pregnancy-associated plasma protein A, which low levels may indicate chromosomal abnormalities like trisomy 21, 18, and 13. And we can also look at HCG, which can show us abnormal aneuploidies as well, like increased in trisomy 21 and then decreased in 18 or 13. So some infectious agents we want you to avoid. Right now, if you have cats, then you get a pass of changing their litter box for the next 9 months because toxoplasmosis is an infection that can exist as a parasite inside cat feces, and then also contaminated water or undercooked meats. So usually our immune system can fight it off, but in pregnancy, we want to avoid that because problems can happen for baby, including like vision issues, developmental delays, and birth defects. So again, like we talked about, no raw or undercooked meats, and then no changing that litter box. Make your husband do it. Also, varicella. If contracted during pregnancy, chickenpox can lead to severe complications for you and for baby. It can be life-threatening to your baby if contracted near delivery, and you would be at higher risk of progressing to pneumonia. So just try and avoid anyone that has varicella, like chickenpox, or any exposures there might be, and just try and keep your distance there and just be a little extra safe. And then vaccines we don't want you to get while you're pregnant would be measles, mumps, or rubella, the live attenuated flu, zoster, or polio. You can do the inactivated flu virus, so just make sure you ask the pharmacy where you're getting it done, or if your work offers it, that if it's live and inactivated. So also just want to touch up real quick on medications. I know that you take levothyroxine at home to manage your hyperthyroidism. With pregnancy, your needs are going to be increased for that as well. So right now you're on the 88 micrograms a day. Go ahead and I'm going to increase that to 112 micrograms a day so that we keep seeing the same type of thyroid function that you currently have. At your next appointment in 4 weeks, we'll recheck your thyroid stimulating hormone and then your T4 and your T3 to make sure we're still at an ideal range. So for follow-up, your next visit will be in 4 weeks. It will continue every 4 weeks until you reach 28 weeks gestation, at which time we'll start seeing you then every 2 to 3 weeks until you're at 37 weeks. And then at that time, we'll see you weekly until your baby comes. Start thinking about what hospital you'd like to deliver at. I can get you a list of the ones I have privileges to work at, and we can choose from there. And then again, if any of those concerning side effects popped up that we talked about, or you feel like you can't manage a side effect at home, then go ahead and go to the ER, and you can give us a call and let us know you're headed there. Now, your next appointment, we will see you in person in the office so that we can do some labs and some scans and stuff for you. Have a great day.